Hi, tummy tuck procedure, also called abdominoplasty. It's a high satisfaction procedure that's a contouring procedure where we're basically tailoring the patient's trunk and typically removing skin and fat in the lower abdomen and then tightening the abdominal muscle. In the procedure, basically we excise the skin that's below the belly button and then we undermine underneath the skin just to above the rib cage, and then we re-drape that skin down, and then we close the incision of the lower abdomen and make a new hole for the belly button. Appropriate candidates for this surgery are people that tend to have excess tissue in that lower abdomen, and this is often women that have had children or people who have had massive weight loss. Often there's a split in the muscle in the abdomen. It's called the rectus muscle, and we tighten that back up, and the excess skin that doesn't always retract after having a baby sometimes needs to be removed. As a contouring procedure, this surgery is customized for every patient, and there can be variations in where the incisions are and the amount of dissection. Most commonly, the incisions come from the anterior parts of the sides of the abdomen and are right down in the lower pubic area just above the pubic hair. And then there's another incision around the belly button. We usually put drains in, and typically one on each side, and they're typically in for 2 weeks after surgery. The surgery can be modified, and sometimes patients need to have more tissue removed from the side. Sometimes they need it all the way around their abdomen. Sometimes patients might benefit from a vertical component that help tighten and pull in tissue from the side. Sometimes patients don't have so much skin that needs to be removed, and they don't need to have their belly button moved, and therefore we call this procedure a mini tummy tuck. And this can be combined with various amounts of liposuction for additional contouring. After surgery, there's an important regimen that needs to be followed for both safety and having good results in a tummy tuck. One of the biggest risk factors for this surgery is getting a blood clot that could become an embolism and go up to a lung. And therefore we typically give patient a blood thinner in surgery to prevent the blood from clotting, and sometimes we give patients blood thinner to take after surgery, depending on their health status. We definitely want patients walking the day of surgery. We want you walking continually to keep the blood flowing and prevent any blood clot. Obviously there's going to be care for the drains, and they need to be empty and recorded. At first it's going to be a few times a day, and it's going to decrease over the days following surgery, and with daily emptying and recording until they're removed. You'll be walking in a bent forward posture to prevent tension on the incision, and typically that's for the first week, and in the second week you'll be standing up straight. The drains, as I said, will likely be removed at about 2 weeks after surgery, and you want to wear compression to prevent from fluid rebuilding up in that area, as well as controlling swelling. There can be variability for patients' return to work after this surgery. On average, patients return to work at about 2 weeks, maybe right after the drains are removed, but I even have some patients who sometimes go back to work after a week. Patients can start going into the water, getting sweaty shortly after the drains are removed, as long as the incisions are robust, and that's in the 2 to 3 week period. At about 6 weeks, patients increase their activity to without restriction, and ultimately after about 2 months, I would like the patient to start doing activities to help enhance the cosmetic appearance of their abdomen. Typically these are core strengthening activities to help decrease their intra-abdominal volume and tighten the abdominal muscles. These all give a nicer final result. There is some swelling after surgery that persists for several months. There is some swelling up to 6 months, but most of the swelling is gone at 3 months, and that's typically when we're giving the judgment about the final results.